Hello and welcome to my YouTube channel. Today I'll be speaking on premenstrual syndrome. When we use the word pre from English as a prefix, it means something before. So we're going to be talking about essentially what that is. Menstrual syndrome, PMS for short. This lady experiences symptoms that start days to weeks before the onset of periods, and the symptoms tend to go away 3 to 4 days after the period starts. Now, what are the symptoms that this patient experiences? Mood swings, feeling depressed or irritable, feeling upset, anxious or emotional, tiredness or trouble sleeping, bloating or cramping, breast tenderness, headaches, changes in appetite or food cravings. Now, what exactly is causing this? Possibility could be due to change in hormonal level. In other words, it's either you're having too much of the hormone or too little of the hormone. So basically, possibility is that it's due to a hormonal imbalance. Could also be due to chemical changes in the brain, particularly serotonin, which is one of the chemicals the body produces. So chemical changes in the brain could also be responsible for the symptoms. Could also be due to the fact that some women may actually have undiagnosed depression that could be manifesting along features of the premenstrual syndrome. So what can you do as a lady? Number one, you can keep a menstrual diary. This diary will help you to establish a predictable pattern. And so what are you supposed to record in this diary? Number one, the first day you notice these symptoms. Number two, the symptoms you experience, the day the symptoms disappear, the start of your period, and when your period ends. What can you really do concerning premenstrual syndrome? Number one, exercise. Number two, healthy eating. This usually will be applicable for so many conditions. On one hand, you could avoid use of medications if possible, and in which case, in addition to the exercise and healthy eating, you could have or be referred for what is called cognitive behavioral therapy, which is a form of talking therapy where discussions will be had about ways that you can adopt coping strategies. Now, in keeping a menstrual diary on your own, you could easily be able to predict when the symptoms are coming and then be able to make some adjustment. But what the CBT or the cognitive behavioral therapy will do for you is to explore other options that you could use to adapt to these symptoms. Now, other things to bear in mind is that you could use paracetamol, ibuprofen. These are over-the-counter medications, but please remember that for ibuprofen, number one, you should not be asthmatic because it could trigger an asthmatic attack. Number two, if you have gastritis or peptic ulcer disease, please do not use ibuprofen. It's also important to mention that medications that could be used for this condition, of course, that would be based on specialist care, will be things like antidepressants as well as estrogen, which would be in the form of a patch or a gel. It's also important to mention that if estrogen patch or gel is going to be used, it will be necessary for such people to be on other medication like progesterone. Premenstrual syndrome is something that you can do something about, and if you're unable to handle it, please see a doctor. Thank you and subscribe.